Welcome to Crazy Nurse RN Hub, where learning becomes a tradition. Come, join me as we explore the multifaceted world of nursing. Hi there, student nurses. My name is Criselmer Ducanes, clinical instructor teaching fundamentals of nursing practice. Today, we will be talking about critical thinking and clinical reasoning. To think like a nurse, critical thinking and clinical reasoning must be defined and understood. Both these terms describe the mental processes nurses use to ensure that they are doing their best thinking and decision making. The practice of nursing requires critical thinking and clinical reasoning. Critical thinking is the process of intentional, higher level thinking to define a client's problem. It examines the evidence-based practice in caring for the client and make choices in the delivery of care. On the other hand, clinical reasoning is the cognitive process that uses thinking strategies to gather and analyze client information. It evaluates the relevance of the information and decide on possible nursing actions to improve the client's physiological and psychosocial outcomes. Clinical reasoning requires the integration of critical thinking in the identification of the most appropriate interventions that will improve the client's condition. The concept of clinical reasoning evolved from the application of decision making to the healthcare professions. Clinical reasoning also guides nurses in assessing, assimilating, retrieving, and/or discarding components of information that affect patient care. Clinical reasoning is often defined in practice-based disciplines such as nursing and medicine as the application of critical thinking to the clinical situation. Now let's discuss the purpose of critical thinking. Critical thinking involves the differentiation of statements of fact, judgment, and opinion. The process of critical thinking requires the nurse to think creatively, use reflection, and engage in analytical thinking. Nurses use critical thinking skills in a variety of ways. First is nurses use knowledge from other subjects and fields. Nurses use critical thinking skills when they reflect on knowledge derived from other interdisciplinary subject areas, such as biophysical and behavioral sciences, and the humanities in order to provide holistic nursing care. For example, when providing care to a client at the end of life, it is important to have knowledge of culture and religion to enhance the delivery of culturally sensitive care and enhance the client's spiritual well-being to promote a good death. The other one is nurses deal with change in stressful environments. The client's condition may rapidly change and routine protocol may not be adequate to cover every unexpected situation. Critical thinking enables the nurse to recognize important cues, respond quickly, and adapt interventions to meet specific client needs at the right time. Lastly, we have nurses make important decisions. Every day and every moment during the day, nurses use critical thinking skills and clinical reasoning to make judgments about a client's care. For example, determining which observations must be reported to the primary care provider or doctor immediately, and which can be noted in the electronic medical record for later consultation with the primary care provider requires critical thinking. Also, clients have different health needs simultaneously. For example, a client who is experiencing an acute asthma attack with air hunger will also experience anxiety. The nurse must administer a medication to improve breathing before addressing the client's anxiety. Critical thinking cognitively fuels the intellectual artistic activity of creativity. When nurses incorporate creativity, they are able to find unique solutions to unique problems. Creativity means, therefore, thinking that results in the development of new ideas and products. Creativity in problem solving and decision making is the ability to develop and implement new and better solutions for healthcare outcomes. Creativity is required when the nurse encounters a new situation or a client situation in which traditional interventions are not effective. Creative thinkers must assess a problem and be knowledgeable about the underlying facts and principles that apply. Now let's proceed to the techniques in critical thinking. The nurse uses other techniques to ensure effective problem solving and decision making. These techniques include critical analysis, inductive and deductive reasoning, making valid inferences, differentiating facts from opinions, evaluating the credibility of information sources, clarifying concepts, and lastly, recognizing assumptions. First, let's discuss critical analysis. Critical analysis is the application of a set of questions to a particular situation or idea to determine essential information and ideas and discard unimportant information and ideas. In inductive reasoning, generalizations are formed from a set of facts or observation. When viewed together, certain bits of information suggest a particular interpretation. Inductive reasoning moves from the specific examples, and that is your premise, to a generalized conclusion. For example, after touching several hot flames, that's the premise, we conclude that all flames are hot. A nurse who observes a client who has a dry skin, poor skin turgor, sunken eyes, and dark amber urine, and who is determined to be dehydrated, and that is the premise, concludes that the presence of those signs in other clients indicates that they are dehydrated as well. Deductive reasoning, by contrast, is a reasoning from general premise to the specific conclusion. A nurse might start with the premise that all children love peanut butter sandwiches. Thus, if the nurse is trying to encourage a client to eat, then the nurse should offer the child a peanut butter sandwich. This is an example in which the premise is not always valid, and thus the conclusion also may not be valid. Nurses use critical thinking to help analyze situations and establish which premises are valid. In critical thinking, the nurse also differentiates statements of facts, inference, judgment, and opinion. For facts, it can be verified through investigation. Example is blood pressure affected by blood volume. Next is inferences, conclusions drawn from the facts, going beyond facts to make a statement about something not currently known. If blood volume is decreased, for example in hemorrhagic stroke, the blood pressure will drop. Judgments, evaluation of facts or information that reflects values or other criteria, and it is a type of opinion. Example, it is harmful to the client's health if the blood pressure drops too low. Next is opinions. Beliefs formed over time include judgments that may fit facts or be erroneous. Nursing interventions can assist in maintaining the client's blood pressure within the normal limits, is an example of your opinion. Therefore, evaluating the credibility of information sources is an important step in critical thinking. When a nurse uses intentional thinking, a relationship develops among the knowledge, skills, and attitudes that are ascribed to critical thinking and clinical reasoning, the nursing process, and the problem solving process. So now we will be applying the critical thinking to nursing practice. Implementation of the nursing process provides nurses with a creative approach to thinking and doing to obtain, categorize, and analyze client data and plan actions that will meet the client's needs. The nursing process is a systematic, rational method of planning and providing individualized nursing care. It begins with assessment of the client and use of clinical reasoning to identify client problems. The phases of the nursing process are assessing, diagnosing, planning, implementing, and evaluating. Now let's proceed to problem-solving process. When we say problem solving, it is a mental activity in which a problem is identified that represents an unsteady state. It requires the nurse to obtain information that clarifies the nature of the problem and suggests possible solutions. Throughout the problem-solving process, the implementation of critical thought may or may not be required in working towards a solution. The nurse carefully evaluates the possible solutions and chooses the best one to implement. The situation is carefully monitored over time to ensure that its initial and continued effectiveness returns the client to a steady state. The nurse does not discard the other solutions but holds them in reserve in the event that the first solution is not effective. Therefore, problem solving for one solution contributes to the nurse's body of knowledge for problem solving in similar situations. Commonly used approaches to problem solving include trial and error, intuition, and the research process. One way to solve problems is through trial and error, in which a number of approaches are tried until a solution is found. However, without considering alternatives systematically, one cannot know why the solution works. The use of trial and error methods in nursing can be dangerous because of the client might suffer harm if an approach is inappropriate. However, nurses often use trial and error in home setting due to logistics, equipment, and client lifestyle. For example, when teaching a client to perform a colostomy irrigation, a bent coat hanger hung on the shower curtain rod provides an appropriate height to perform the irrigation. In the hospital setting, however, a lowered intravenous pole is more likely utilized. Now we have intuition. It is a problem-solving approach that relies on the nurse's inner sense. It is a legitimate aspect of nursing judgment in the implementation of care. Intuition is the understanding or learning of things without the conscious use of reasoning. It is also known as the sixth sense, hunch, instinct, feeling, or suspicion. As a problem-solving approach, intuition is viewed by some people as a form of guessing and as such an inappropriate basis for nursing decisions. However, others view intuition as an essential and legitimate aspect of clinical judgment acquired through knowledge and experience. Now let's discuss clinical judgment. Clinical judgment in nursing is a decision-making process to ascertain the right nursing action to be implemented at the appropriate time in the client's care. The nurse must first have the knowledge base necessary to practice in the clinical area and then use that knowledge in clinical practice. Clinical experience allows the nurse to recognize cues and patterns and begin to reach correct conclusions. Although the intuitive method of problem solving is gaining recognition as part of nursing practice, it is not recommended for novices or students because they usually lack the knowledge base and clinical experience on which to make a valid judgment. Now let's proceed to the attitudes that foster critical thinking. Certain attitudes are crucial to critical thinking. These attitudes are based on the assumptions that a rational person is motivated to develop, learn, grow, and be concerned with what to do or believe. A critical thinker works to develop the following 9 attitudes or traits. First is independence. Critical thinking requires the individuals to think for themselves. Next is fair mindedness. Critical thinkers are fair minded and make impartial judgments. They assess all viewpoints with the same standards and do not base their judgment on personal or group bias or prejudice. Next is insight into egocentricity. Critical thinkers are open to the possibility that their personal biases or social pressures and customs could unduly affect their thinking. They actively try to examine their own biases and bring them to awareness each time they think or make a decision. By failing to reflect on personal biases, the nurse may reach inappropriate conclusions for the individual client. Next is intellectual humility. Critical thinkers are willing to admit when they do not know. They are willing to seek new information and to rethink their conclusions in the light of new knowledge. Next is intellectual courage to challenge the status quo and rituals. With an attitude of courage, a nurse is willing to consider and examine fairly his or her own ideas or views, especially those to which the nurse may have a strongly negative reaction. This type of courage comes from recognizing that beliefs are sometimes false or misleading. Values and beliefs are not always acquired rationally. Rational beliefs are those that have been examined and found to be supported by solid reasons and data. Next is integrity. Intellectual integrity requires that the individuals apply the same rigorous standards of proof to their own knowledge and beliefs as they apply to the knowledge and beliefs of others. Critical thinkers question their own knowledge and beliefs as quickly and thoroughly as they challenge those of another. They are readily able to admit and evaluate inconsistencies within their own beliefs and between their own beliefs and those of others. A nurse might believe that the wound care always requires sterile technique. Reading a new article on the use and outcomes of clean technique for some wounds leads to the critically thinking nurse to reconsider. Next is perseverance. Because critical thinking is a lifelong endeavor, nurses who are critical thinkers show perseverance in finding effective solutions to client and nursing problems. This determination enables them to clarify concepts and sort out related issues in spite of difficulties and frustrations. Confusion and frustration are uncomfortable, but critical thinkers resist the temptation to find a quick and easy answer. Next is confidence. Critical thinkers believe that well reasoned thinking will lead to trustworthy conclusions. Therefore, they cultivate an attitude of confidence in the reasoning process and examine emotion laden arguments using the standards for evaluating thought. Lastly, curiosity. The mind of a critical thinker is filled with questions. Why do we believe this? What causes that? Does it have to be this way? Could something else work? What would happen if we did it another way? Who says that is so? The curious nurse may value tradition, but it is not afraid to examine traditions to be sure that they are still valid. The nurse may, for example, apply these questions to the issue of moving responsibility from a procedure, such as drawing of arterial blood samples, among the nursing, respiratory therapy, or laboratory department staff. Now let's proceed to the components of clinical reasoning. Clinical reasoning is the analysis of a clinical situation as it unfolds or develops. It requires the nurse to use cognitive and metacognitive processes. Cognitive processes are the thinking processes based on the knowledge of aspects of client care. Cognitive skills are learned through reading and applying health-related literature. Cognitive skills are enhanced through the use of critical thought to understand and apply the content the nurse has previously learned. For the metacognitive processes, these include reflective thinking and awareness of the skills learned by the nurse in caring for the client. The nurse reflects on the client's status and through the use of critical thinking skills determines the most effective plan of care. Now let's proceed to setting priorities, which is one of the components of clinical reasoning. In the current nursing world, nurses have to think quickly to resolve problems. Therefore, priority setting needs to be dynamic or flexible because the clinical environment can change quickly, requiring changes in priorities. Next component of clinical reasoning is developing rationales. After assessing the data and determining what is relevant to the client's condition and concerns, the nurse identifies interventions and sets priorities for the most urgent needs. This is when the nurse transfers nursing knowledge to the clinical situation to justify the plan of care. Being able to state the rationale based on the nursing knowledge acts as a check for potential errors, justifies the nurse's actions, and contributes to client safety, and helps the beginning nursing student learn how a nurse thinks in practice. Next component is learning how to act. The nurse must know how and when to respond in a clinical situation by recognizing what is most urgent or significant. To take action, the nurse needs to understand the relevant medical and nursing information and translate this knowledge into a plan of care. An example is thinking about potential complications given the client's current problems. Applying this knowledge increases the nurse's ability to quickly identify assessment data that indicate a potential complication. Thus, the nurse can initiate nursing interventions or actions quickly because he or she is prepared for the possibility. Avoiding potential complications promotes client safety. Next component is clinical reasoning in transition. It is important to realize that the clinical situations are complex and always changing, especially given the acuity level of the clients in today's hospital settings. Clinical reasoning in transition is the ability to recognize subtle changes in a client's condition over time. It includes the evaluation of nursing interventions and the trending of the relevant assessment data. Nurses need to develop a sense of what is most important in each changing clinical situation and remember that the primary focus is on the client's well-being. Next component is responding to changes in the client's condition. Nurses spend more time with the clients than do other healthcare providers. As a result, an important aspect of nursing practice and the nurse's responsibility is to detect changes in the client's condition, recognize a change in priorities, adjust nursing care, and alert the primary care provider when appropriate. Clinical reasoning involves an understanding and assessment of the client's relevant history and current condition and how it may be changing. By closely monitoring and comparing any changes from previous assessment data, the nurse is able to recognize a change in status that may prevent an adverse outcome. Next is reflection. Reflection is a key to the success of clinical reasoning. Through reflection, the nurse identifies factors that improve client care and those that require changing or elimination. It is important to reflect on whether the client was assessed accurately and in a timely manner. The nurse thinks back on the interventions implemented and whether they were effective. Most importantly, reflection includes information on the outcome of care. The nurse also reflects on previous clinical experiences similar to this one to determine if the outcomes of care improve the client's condition. Now let's proceed to concept mapping. It is a technique that uses a graphic depiction of nonlinear and linear relationships to represent critical thinking, also known as mind mapping. Concept maps are context dependent and can be used to develop analytical skills. The attributes of the concept are linked, making meaning of the concept they represent. Concept maps provide an opportunity to visualize things in your own way. The concept map also allows the nurse to map words on a page and focus on concepts and relationships. The general benefit of these maps is that they are quicker than note taking and highlight key ideas. I believe this is the end of our lecture on critical thinking and clinical reasoning. Thank you so much for listening.